Welcome to Medicine Handy Point. Today we will discuss history taking from a patient presenting with headache. So it's a very important topic and very common presentation in OPD. So let's discuss. First, as usual, we'll ask about the onset, acute onset, and severe headache means subarachnoid hemorrhage. So that's why answer is important. Then we will ask about duration. Is migraine headache can last up to 3 days, while the cluster headache can last from few minutes to hours. So duration is important in that context. Then about the site of the headache. For example, about the site, bilateral frontal headache is a tension headache. Unilateral frontoparietal headache is migraine. Unilateral rectoorbital headache is cluster headache. And headache in temporal area is temporal arthritis. Occipital headache is subarachnoid hemorrhage or meningitis. So, head the site is important in this context. Then about the nature of the headache, we'll ask about whether it is a throbbing. Throbbing is usually in the migraine, sharp and shooting. What kind of headache? We will ask that. Then ask about the severity of the headache. Severity: mild, moderate, and severe. So the severe form headache with the patient will be unable to do any work. Then we will ask about the frequency, whether the headache is continuous, intermittent, episodic. We will ask about that. Occurs daily. Then ask about the radiation of the headache. As occipital headache with radiation to the neck is meningitis. Sometime there is a facial, tooth or ear pain which radiates to the head. So radiation is important in that context. Then we'll ask about the aggravating factors. For example, if migraine headache is aggravated by cheese, chocolate, hunger, sleep deprivations, sounds, bright light, menstruation, sexual activity, while sneezing, coughing, and bending forward aggravate the headache associated with raised intracranial pressure. And raised intracranial pressure has a lot of causes. Then we'll ask about relieving factors. So sleep, dark room, analgesic. We'll ask what makes the headache better. Then we have to ask about the alarm symptoms. That's a very important. We in headache history important. We have to ask about that. Sudden onset of severe headache is subarachnoid hemorrhage. Focal neurological deficit with the headache. It can be space-occupying lesion or any again subarachnoid hemorrhage, any vascular accident. Headache, seizure with headache again can be space-occupying lesion or some infection, abscess, meningitis. So seizure which should be asked about. New headache in high risk patient, like in a pregnant patient developing headache. So we have to rule out deep venous sinus thrombosis, previous malignancy, and now presenting with a headache. It could be matched to the brain. So we have to ask about the alarm symptom, which includes the severe form of headache, focal neurological deficit, seizures, and new onset headache in a high risk patient like pregnant and previous malignant patient. Then we'll ask about the associated symptom, ask about aura, photophobia, photophonia, which occurs in migraine headache. Ask about lacrimation, rhinorrhea, drooping of eyelid, and conjunctival stuffiness. Cluster headache. Ask about stressor, tension headache. These three are primary headaches. Then ask about any wing weakness, any other neurological deficit. It could be CVA. Ask about fever, neck stiffness, and rash. It could be meningitis. Ask about fever, confusion, and headache. Could be encephalitis. Ask about low grade fever, weight loss, chronic headache, maybe TBM. Ask about scalp tenderness and jaw claudication. It could be temporal arthritis. Past medical history should include asking about migraine, cluster headache, malignancy in the past, head trauma, depression, anxiety, and bleeding disorders. Family history should include migraine and thrombophilia. In context, there may be some clot in the brain, so thrombophilia. Medication history. Some medication causes headache, so these include nitrates can cause calcium channel blocker, OCPs in a female can lead to DUST, steroid vitamin A can cause benign intracranial hypertension. So these should be asked. I hope you liked the video and please subscribe to the channel.